Welcome to Nursing Prep. Push yourself in nursing preparation with smart way. Practice this quiz on www.thestudyblog.com. Fundamentals of nursing. Which term does the nurse document to best describe a client experiencing shortness of breath while lying down who must assume an upright or sitting position to breathe more comfortably and effectively? Option A. Dyspnea. Option B. Hypopnea. Option C. Orthopnea. Option D. Acapnea. Right answer is Option C. Orthopnea. Respiratory difficulty related to a reclining position without other physical alterations is defined as orthopnea. A client with emphysema is prescribed corticosteroid therapy on a short-term basis for acute bronchitis. The client asks the nurse how the steroids will help him. The nurse responds by saying that the corticosteroids will do which of the following? Option A. Promote bronchodilation. Option B. Help the client to cough. Option C. Prevent respiratory infection. Option D. Decrease inflammation in the airways. Right answer is Option D. Decrease inflammation in the airways. Glucocorticoids are prescribed because of their anti-inflammatory effect. Options 1, 2, and 4 are not achieved with glucocorticoids. The nurse is planning to perform percussion and postural drainage, which is an important aspect of planning the client's care. 1. Percussion and postural drainage should be done before lunch. Nurse Aleli is planning to perform percussion and postural drainage, which is an important aspect of planning the client's care. Option A. Percussion and postural drainage should be done before lunch. Option B. The order should be coughing, percussion, positioning, and then suctioning. Option C. A good time to perform percussion and postural drainage is in the morning after breakfast when the client is well rested. Option D. Percussion and postural drainage should always be preceded by 3 minutes of 100% oxygen. Right answer is Option A. Percussion and postural drainage should be done before lunch. Postural drainage results in expectoration of large amounts of mucus. Clients sometimes ingest part of the secretions. The secretions may also produce an unpleasant taste in the oral cavity, which could result in nausea/vomiting. This procedure should be done on an empty stomach to decrease client discomfort. Nurse Winona teaches a patient how to use an incentive spirometer. What patient outcome will support the conclusion that the use of the incentive spirometer was effective? Option A. Supplemental oxygen use will be reduced. Option B. Inspiratory volume will be increased. Option C. Sputum will be expectorated. Option D. Coughing will be stimulated. Right answer is Option B. Inspiratory volume will be increased. An incentive spirometry provides a visual goal for an measurement of inspiration. It encourages the patient to execute and maintain a sustained inspiration. A sustained inspiration opens airways, increases the inspiratory volume, and reduces the risk of atelectasis. Patients who use an incentive spirometer may or may not be receiving oxygen. Option 1. Nurse AJ is applying a warm compress. What should the nurse explain to the patient is the primary reason why heat is used instead of cold? Option A. Minimizes muscle spasms. Option B. Prevents hemorrhage. Option C. Increases circulation. Option D. Reduces discomfort. Right answer is Option C. Increases circulation. Heat increases the skin surface temperature, promoting vasodilation, which increases blood flow to the area. Cold has the opposite effect. It promotes vasoconstriction, which decreases blood flow to the area. Both heat and cold relax muscles and thus minimize muscle spasms. A practitioner orders chest physiotherapy with percussion and vibration for a newly admitted patient. Which information obtained by the nurse during the health history should alert the nurse to question the practitioner's order? Option A. Emphysema. Option B. Osteoporosis. Option C. Cystic fibrosis. Option D. Chronic bronchitis. Right answer is Option B. Osteoporosis. Implementing the practitioner's order may compromise patient safety because percussion and vibration in the presence of osteoporosis may cause fractures. Osteoporosis is an abnormal loss of bone mass and strength. Option 1. These are appropriate interventions for a patient with emphysema. Emphysema is a chronic pulmonary disease characterized by an abnormal increase in the size of air spaces distal to the terminal bronchioles with destructive changes in their walls. Nurse who teaches a patient about pursed lip breathing. The nurse identifies that the teaching is affected when the patient says its purpose is to. Option A. Precipitate coughing. Option B. Help maintain open airways. Option C. Decrease intrathoracic pressure. Option D. Facilitate expectoration of mucus. Right answer is Option B. Help maintain open airways. Pursed lip breathing involves deep inspiration and prolonged expiration against slightly closed lips. The pursed lips create a resistance to the air flowing out of the lungs, which prolongs exhalation and maintains positive airway pressure, thereby maintaining an open airway and preventing airway collapse. What should Nurse Mavie do first if a patient is choking on food? Option A. Apply sharp foot thrusts over the patient's xiphoid process. Option B. Determine if the patient can make any verbal sounds. Option C. Hit the middle of the patient's back firmly. Option D. Sweep the patient's mouth with a finger. Right answer is Option B. Determine if the patient can make any verbal sounds. When a person is choking on food, the first intervention is to determine if the person can speak because the next intervention will depend on if it is a partial or total airway obstruction. With a partial airway obstruction, the person will be able to make sounds because some air can pass from the lungs through the vocal cords. In this situation, the person's own efforts, open parentheses, gagging and coughing, should be allowed to clear the airway. Nurse CJ is caring for a client who is having difficulty breathing. The client is lying in bed and is already receiving oxygen therapy via nasal cannula. Which of the following interventions is the nurse's priority? Option A. Increase the oxygen flow. Option B. Assist the client to Fowler's position. Option C. Promote removal of pulmonary secretions. Option D. Attain a specimen for arterial blood gases. Right answer is Option B. Assist the client to Fowler's position. The priority action the nurse should take when using the airway, breathing, circulation approach to care delivery is to relieve the client's dyspnea. Fowler's position facilitates maximal lung expansion and thus optimizing breathing. With the client in this position, the nurse can better assess and determine the cause of the client's dyspnea. The client may need more oxygen, as hypoxemia may be the cause of his difficulty breathing. An elderly nursing home resident has refused to eat or drink for several days and is admitted to the hospital. The nurse should expect which assessment finding? Option A. Increase blood pressure. Option B. Weak, rapid pulse. Option C. Moist mucous membranes. Option D. Jugular vein distension. Right answer is Option B. Weak, rapid pulse. All other options are indicated of fluid volume excess. A client who has not eaten or drunk anything for several days would be experiencing fluid volume deficit. Thanks for watching. You can also practice this quiz on www.thestudyblog.com, link in description box. If you have any doubt, ask in comment section, and you like our video, then do like, comment, share. Subscribe our channel for regular updates.